Good evening, friends. I'm Dr Venkatesh, Urology faculty from DocTutorials and team RRM Next. So, as usual, this year also we have cracked this session. Also, a lot of our students have cracked through this INI SS Urology 2025 May 2025 session. So, in this outlet now we have Dr Bhanu Prakash with us. So, he has secured an amazing rank of AML Rank 11 in this last session. So, on behalf of our team DocTutorials and team RRM Next, I would like to congratulate Dr. Bhanu Prakash. So we welcome you here, Dr. Bhanu Prakash. I'm really happy to have you here. So many congratulations at the outset. So please introduce yourself and please briefly share your experience of and your journey towards this exams and preparation on it, Bhanu Prakash.
Yes, sir. First of all, thank you, sir. Myself, Bhanu Prakash. I have born and brought up in Andhra Pradesh. I have done my UG from Government Medical College, Anantapur, and I have done from my MS from JIPMER, Pondicherry. I have passed out in October 2024, sir. After that, I have joined as SR in JIPMER, Pondicherry only for 3 months, and then I have resigned, and then I was preparing for NEET and INI SS, sir.
So good. So this was your. Did you give any INISS beforehand, or this was your first attempt on it, Bhanu Prakash?
Actually, this was my second attempt, sir. But last time I given for plastic. After that, when I was preparing for NEET, I decided on urology. When I was doing SRship, I decided on urology. And by the time I fixed on NEET, so I decided urology I had to get in. Then I started preparations towards urology.
Okay. So what made you to incline towards urology? Because you had given plastic previously and now you've taken up urology. Both are something different horizons. So just interesting fact, what made you to incline towards urology, Bhanu Prakash?
Like when I was joining MS, I was sure that I want to do urology, sir. But when I was going towards my MS, I was confusion between plastic and urology. But last time I given for plastic, but when I'm going through my SRship, I realized that I want to do more of open cases, laparoscopy cases, and robotic cases, laparoscopy cases. So I think my interest is in this field, and also I want to do in a branch which provides a job satisfaction, which a patient has to come out of that suffering of disease. So I think that way will get more in urology. That's why
Yeah,
I
that's
was
true.
on
That's
urology.
true.
And
You get a lot of gratitude and gratification both from your side. Also, the patients will feel very happy going home. Not taking about
yes,
anything else, but being a neurology, you have a more. It's a nice feel. It's a nice mix of everything. You have everything in it. So
yes,
that's
a
good.
variety of cases also I can be able to do.
And there are a lot of super specialties also. You can super specialize on that as well. So the opportunities of windows wide open in urology. So you will never regret on that. You will be very, very happy and proud to be a neurologist on that part. Bhanu Prakash, you can take my word on it. Okay.
Yes, sir.
So
Thank you,
now
sir.
take us through your preparation. So what were your materials you had and how did you prepare? Did DocTutorials help you in any modality on your preparation? Just throw some light on it, Bhanu Prakash.
Yes, sir, definitely. Like when after I fixed that urology, I didn't get better rank in NEET. So after that, I have taken 1 week break. After that, I have taken DocTutorials, sir, and the videos, lectures that helped me a lot, sir. And the concepts you taught are crisp and very clear. That has helped me better to understand and to recall also. So for first 30 days, I have given only for classes, sir. Only for classes along with MCQs. I've done some 70% time only for classes and to understand more than rushing over the time. I concentrated on understanding the concepts because most of these Urodynamics and some initial lasers, those are the questions will be direct, but the understanding should be there behind that. So I thought I realized it that based on previous questions. So I thought like first I have to finish the classes, but that too with understanding, not to rush. Those are 30 days I taken for to complete classes along with question bank. After that, I focused on revision, sir. At that time, I kept time bonds for revision, and also in second and third revision, I kept which I am lacking in, and which needs repetitive revision, and also memory points like embryology, which are derivatives. Those I have focused on more. So in second and third revision, where I'm going wrong, those I focus. In first reading and first revision, I have followed like I have to remember it more better. In that way,
That's
classes
nice.
help.
That's nice. So when did you start actually preparing for INI SS
I
Urology?
have
So
actually started after 5 days of NEET happened, sir.
that means you hardly had about 2 to 3 months, right?
Yes, sir. Like I usually remember whatever you were saying, 2 to 3 months of hard preparation is enough, and you can go through it. I repeatedly remember myself actually.
Yeah,
Uh,
that's what I want to stress here. See now, people don't understand if I say that. So they doubt me that I'm just giving them some false belief. That is not needed. See, right here you have Bhanu Prakash. So far, I will just tell you, I have interviewed a couple of students now. All those have been preparing for 1.5 years, and they've been getting near through INISS. They secured good ranks in NEET SS. So you are the one who didn't do because you just finished it. I understand that point, but that is what you need not give up on that. Like once you have a failure in one thing, it's not like that. By the time we all medicos know, it is not a one-day event. You have to be perseverant on it. So that's I'm really happy that this is quite interesting. Like you have started preparing only in last 2 months, and you were able to secure a rank of 11, man. Something phenomenal, Bhanu Prakash. Many congratulations. So that shows
Thank you,
a
sir.
lot of
Thank you, sir.
effort you have put in. You have believed in the process. You have believed in whatever we said, and I think you have trusted only with the content you had. I think for lack of time, I don't think you would have gone and read back to the textbooks, right?
I didn't go through textbooks, sir. Only the
Okay.
classes and the notes you kept, the notes you can maybe your teaching style suits me, I think, sir. So the notes you are given, the notes I made very clear and I focused on revision more. Like
Okay.
a recall, active recall also is helped me better, sir.
That's great. That's great. So this is something different. So all those students are thinking like, I didn't get through. I have very short, limited time. Is it really worth to give INISS? So here we have Dr. Bhanu Prakash, who have just taken 2 months of time, and he was able to crack through in the first attempt.
I
So
was
many,
I
many
was in that phase, sir. I was in that phase as starting, and when I was going through the process, I started believing myself after seeing
believing
Jesus
in yourself.
face and
So that's good. That's good. So, what is your one piece of word of advice to all the juniors or your aspirants who is preparing for the subsequent sessions as well, Bhanu Prakash? Please give your insights onto it.
I would like to tell one thing is the belief in oneself is important, sir. That because not because on result, what the result can be, we also don't know, but we have to give 120% of our efforts. And one more thing is planning with doing with plan. And I have planned for 50 days, 50, 60 days. I have planned whatever I have to do. Maybe it cannot go according to the plan, but we can have an idea which can go some 30% we are lacking, 20% we are lacking. We will know and we can plan for that. So plan prior and then doing has helped me better. So those two things I'll focus on. And for the information, the notes, whichever you given, and the uh, question bank information is higher than previous year questions, having an idea of previous year questions, and where we cannot have a chance the previous year questions. That is more
So I
important.
think
I would like to tell.
every year we have a recall because as you see, like since you touched on, I will touch this. We have not just every session we keep on adding few contents in it. So I think if you go through the last 5 6 sessions of previous year questions, the some topics are often repeated. Say it could be a renal trauma, it could be the onco part, uro onco part. All those topics are getting repeated. Don't get the same questions as such, but you
No,
tend to
but
get a lot of repeated questions. So that's good.
yes,
That's
sir.
good.
Topics should be will be have to be thorough with, sir. And also you were adding of lectures of basics that lasers and all and structure that also has helped. Like previously I thought like why these lectures are because then I went through the previous year questions, then these lectures are being added because of previous year questions are being
No,
asked.
that's what
So I
we
focused on
want
it.
to refine ourselves. We are also updating. See every
Yes,
year
sir,
if
that
you
has
see
helped
the
me.
questions are changing. Now even the mock interview also they have changed the pattern. So because we've been training them so well that now they also changed the set of investigations. So previously last year 1.5 years back they used to have the same set of IVPs and stuff. Now they have gone on to adding mitomycin, other injections and other clinical case scenarios also. So we will also chase them and we will train you as well in the subsequent sessions.
Yes,
So
the
that's
mock
nice.
interview also. One
Yeah,
thing
yeah,
I want
please
to
go ahead.
mention, sir, because I am not very sure. Like I don't have an idea of how interview will go. Mock interview also has helped me. Some one or two questions. If it shows one picture of a radiology, and 2 to 3 questions below that, they will be like this. So that has helped me in the interview, because without having an idea going into an interview, but after having an idea going is different. So that has helped me in the interviews.
Yeah, that was the whole idea of doing mock session, Bhanu Prakash, because you have only hardly 5 to 10 minutes. It's a digital platform. You don't know what to expect out of it. So we will just prime you. You may not get the same questions, but you will know what to expect and how to express yourself, because you have to impress them in that short stipulated time of 5 to 10 minutes. So
Yes,
I think that mock session also helped you out. That is not just because of my efforts. It's also because of students like us. Your seniors before and was got, they just update me on the questions as well, so that we can give an updated version every year. So that is easy from my end also. That will help you out, help the subsequent batch of students as well. So I would expect those kind of feedback from you guys as well. So thank you so much, Bhanu Prakash, for being here. I'm really happy that and really amazed that you in a very short span of 2 months you're able to crack this in your first attempt. So very, very happy for you, and I wish you all the very best, Bhanu Prakash.
Thank you, sir. Thank you, sir.
Good night. Vinod.